Good afternoon, everyone. We'll go ahead and begin the news conference. I want to remind everyone that this meeting is being streamed live on Tippecanoe County Government's YouTube channel and also on Facebook Live. We also have sign language services available. So with that, Dr. Adler.
Thank you, Commissioner Brown. Good afternoon. Thank you all for attending. This afternoon I'll be covering several topics related to COVID-19 here locally. After that, we'll have an opportunity for questions and answers, and also an opportunity for other members of this panel to make any comments if they'd like to. As of today, Tippecanoe County has 38 confirmed cases of COVID-19 and 1 death. 10 of our 38 confirmed cases have been hospitalized. 2 of them are currently on ventilators. Locally, we have had 735 tests run through the Indiana State Department of Health for COVID-19. Our hospital labs have performed 1,231 tests for COVID-19. In addition, commercial labs are also performing tests for COVID-19. As you're all aware, testing availability has been an ongoing issue, both locally and nationally. However, testing capabilities are currently expanding. A good example of this are the drive-through testing capabilities at one of our local hospitals. In addition, there are some new rapid tests available that we hope to have in our area soon. One of the issues due to the lack of testing has been a suspicion that there are more cases locally than we know about. We think that will improve as testing becomes more readily available. Because of this, the health department is going to start tracking suspected COVID-19 cases. So these are cases in individuals who've been evaluated by their healthcare provider and diagnosed with probable or suspected COVID-19, but have not had testing because they either do not meet the criteria for testing or because testing is not feasible. We feel that tracking these numbers of suspected cases will help give us a better idea of the coronavirus activity in our community. I did want to comment on another type of testing that has become available and is being promoted locally at various sites, and that is a blood antibody test to coronavirus. This particular blood antibody test has several limitations, and we caution individuals about relying on this test. Because of these limitations, which do include the possibility of false positive and false negative results, the blood antibody test is not currently endorsed, administered, or interpreted by the Tippecanoe County Health Department. Individuals who choose to have this test done should discuss their results with their healthcare provider, who can accurately interpret the results and advise them about their next steps. One issue that has been on everyone's mind recently has been the projected surge in COVID-19 cases in Indiana and locally. The most recent projection models have predicted that Indiana's surge will occur on April 16th. And we are expecting the same to occur here locally around that date or shortly thereafter. Because of that projected surge, it is vitally important for all of us to follow Governor Holcomb's stay-at-home order and to practice social distancing. We should be at home except to perform essential activities and essential travel. Essential activities and travel are things like going to work, going to the grocery store, the pharmacy, the doctor's office, and traveling to take care of loved ones. If we're not doing these things, we should be at home. If we are out, we should avoid crowds. We should maintain a social distance of 6 feet between ourselves and other people, and we should be practicing meticulous hygiene, including frequent hand washing and disinfection of commonly touched surfaces. I cannot overemphasize the importance of these measures. These measures are our best weapons, our best actions at this point to prevent a large surge in COVID-19 cases here locally. We all must be doing these things to stay safe and healthy. In accordance with social distancing practices, Governor Holcomb updated his executive order on April 6th to include additional measures for businesses to take. And we at the Tippecanoe County Health Department agree with those measures and want to emphasize those to all businesses. These measures are limiting the number of customers in the business at any one time, limiting hours of operation, implementing separate operating hours for elderly and vulnerable individuals, designating 6-foot distances for customers who are in line, providing hand sanitizer and sanitizing products to customers and to employees, promoting delivery or curbside pickup of goods when possible. In addition, businesses should modify their operations to prevent the formation of crowds both inside and outside of their place of business. Businesses should limit the promotion and sale of non-essential items, and businesses should encourage only one member of a household, whenever possible, to enter the business. Another issue that we get asked about a lot are church services, particularly with Easter fast approaching. In-person church services are prohibited by the governor's order due to the size of their crowds. We were asked about drive-in church services. Our recommendation at the health department is that churches should preferably do online or live stream services. However, if a church does choose to have a drive-in service, the following measures should be taken. Sick individuals and individuals at high risk should stay home. No one would be permitted to leave their vehicle. Vehicle windows should remain closed for the duration of the service. There should be no restroom availability. There can be no distribution of communion and/or wine or juice, and no collection baskets. We have been aware of other churches who are planning drive-in or drive-through Easter egg hunts, and we have advised against this, as that would be a form of non-essential travel. Last week, the CDC updated its guidance on masks for the general public. Because of the presence of asymptomatic and pre-symptomatic transmission of coronavirus, the CDC is now recommending that all people wear a cloth mask in public settings where other social distancing measures are difficult to maintain. For example, the grocery store or pharmacy. It's important to note that even with a mask on, we must still practice social distancing and our other measures for preventing infection. These masks do not make us invincible to coronavirus, and we still need to do all these other things to protect ourselves. At this time, I would like to invite any comments from our other panel members.
Well, just real quickly, some of you may have noticed that in the city of West Lafayette, we, for the most part, done away with all of our public meetings in person. We recognize that a lot of our population base understands the difference between city and West. But on Monday night, we had our first, we're using the term electronic council meeting, and it served to be very, very, very productive and very beneficial. There was no two people, no two counselors or myself or anybody else that were in the same room together. We had the council members and myself and the audience all able to speak. We had some protocols that we initiated at the beginning of the meeting so they wouldn't talk over each other, but it really allowed for us to be able to continue with the business of government while abiding by the recommendations and the requirements that we're currently under due to this circumstance. And that has led into other ways for government to do business. And probably one of the best things that we've learned from this is that people are willing to comply. If you let them know what they need to do, they're willing to comply. The original presumption was that people thank you so much for giving us so much focused attention, is that people are taking this seriously. And as everybody has said, that is the only way we're going to get through this, basically in one piece, is if we all pay close attention to the rules and stick to them.
And I would like to, of course, echo what John has just said. We in county government, most of our operations are still active, although doing business differently than we have in the past. I appreciate the public's patience as we work through some of the kinks and work to make some of those processes better. The tax bills did go out at in the last week or so, and again, we've had a lot of folks walking up and doing business here. I want to remind you those can be sent in by mail, can be dropped off at one of the Staley credit union locations as well. And remember that the governor's executive order did allow for a waiver of the penalty that would normally be assessed after that due date. It's been waived for 60 days. You know, we're a community of collaborators and collaboration. We work very well together, but I feel very comfortable in saying that I have never seen the level of collaboration in our hometown that we have in the last 3 weeks. And it happens because a lot of people are talking and communicating, and we all have your best interest at heart. And I would just ask that you continue to work with us. And as Dr. Adler said earlier, we can't state it strongly enough. Please stay home. You know what essential travel is. I feel confidently. Stay home when you can. Limit your exposure and help our folks that are working on the front line. They're doing an incredible job day in and day out. All of our healthcare providers and the people that are fighting the battle from the first responder stages and everything. But do your part to help out by staying home as much as you possibly can, and being sure that if you're venturing out, ask yourself that question first: Is this truly essential? And we'll get through this together. And we can't, of course, promise you that that's going to be anytime soon. We don't have a crystal ball. We'll wait and see what the next couple of weeks bring us and move on from there.
I'll just echo quickly a couple things that John and Tracy and Dr. Adler said that tie a little bit into the warming up of the weather and how nice it is outside. And please just ask everybody, all of our playgrounds have all been taped off. All of our basketball goals are either locked or have mechanisms on so they can't be used. And we do want to ask everybody to please adhere to that. I know it's very difficult when the sun is shining like today, but those areas can very easily be places where this virus could be spread, where people can congregate. When we first put up the signs, we didn't get the compliance we want, so we have them all taped now, but I will say thank you. For the most part, people are very much adhering to that. So if you are using some of our outdoor facilities to walk, to get some of that exercise or that mental health well-being that we talked about, please make sure that you're either wearing a mask, staying 6 feet apart, but please stay away from all the playground, basketball goals, and the other type of recreational equipment that's out there. I know it's not easy during this time period, but these next 2 weeks, as you heard Governor Holcomb say the other day, they are absolutely critical. And he used the term, there will be consequences, good or bad, depending on how well we get through these next 2 weeks. And so all of this plays into to us getting through that well. So please, a little extra attention to the outdoor activities, because even though you're outdoors, the virus still can be spread. We need to make sure that we're taking that seriously. And then just a huge thank you to the whole community. There's so many good things going on with people that are making masks, restaurants that are closed, that are delivering food to the hospitals, the Community Foundation, the United Way working to raise money, what Food Finders is doing, the high school corporation still getting meals to our students. There is just an unbelievable amount of goodwill. The heart and soul of Greater Lafayette is alive and well. And it's just, even though it's a difficult time, it's a remarkable place to be, to see the goodness in people and what's happening here.
I'll just, a couple of comments just to update on the status of the hospitals, and I'll speak for IU Health Arnett. I'm Jim Bean, I'm the Chief Medical Officer. First, I appreciate the comments that all 4 individuals have made before me, but in particular the unambiguous guidance that Dr. Adler has provided us really appreciate the clarity. So hospitals, my hospital, IU Health, is doing okay. The efforts that we all have made to stay home and adhere to the recommendations are working. People are tolerating the rules that we've placed on visitation, and as difficult as that is, it's working, and we're not having the volume of people in the facility that we typically would. One thing about that concerns me a bit. I've heard some anecdotal stories that some people who really needed to go to the emergency department for a medical concern maybe hesitated too long and waited a day or two before seeking care for a concern that we really would have preferred they see a physician sooner. So I want to send a message that the facilities are safe. If you have an emergent medical concern, you need to go to the emergency room, and don't be hesitant because of this pandemic to make that kind of decision. The hospitals have masks and clean environments so that you can be taken care of in a safe way, and so that's one point I'd like to make. I also would like to just thank the healthcare community. This has been a huge disruptor to the usual way of providing care for people. Our work is relational, and so much of it now has been shifted to virtual or has been not occurring, and that's difficult for all of us in healthcare to be away from those kind of connections with people and give them the opportunities to help in the ways that we usually do. So I appreciate my colleagues throughout the community who are figuring out how to care in new ways so rapidly.
My name is Dan Wickert, and I serve as the Vice President of Medical Affairs at Franciscan. We are in the same position as IU. Right now things are relatively safe and comfortable at this point. We have done numerous attempts to, the concern of people coming to the emergency department, we made attempts to separate individuals for those who would have respiratory complaints and concerns versus those that do not have respiratory complaints. So if you have chest pain, if you have other conditions that would require emergency care, know that we are making all efforts to separate individuals who might be COVID positive versus those who are not, and taking those precautions. And I just echo what everyone else has said. Thank you. The community has really come together. It's been interesting to see how all of this has worked. Again, waiting for the potential surge is what we're all trying to plan for at this point.
Thank you. At this point, we'd be happy to entertain questions from the press.
Thank you. Doctor, with that expected surge and expected surge date, what is the thinking on available bed space locally, ventilators, PPE, that sort of thing? The models that I've seen would indicate that there is enough, but I don't know. I'm not really looking at local models. I'm looking at state stuff.
Would Dr. Bean or Dr. Wickert care to comment on their hospitals?
So right now, from a space perspective, rooms as well as ventilators and personal protective equipment, IU Health is in good stead. We have only a few individuals right now who are on ventilators, and we have the capacity for 30 or more ventilators. So we have a significant buffer capacity and the opportunity to expand beyond that if needs be. So we feel pretty good about how we're doing now.
Yeah, and I would agree. We have tried to increase our intensive care unit beds. We've readapted some of our rooms that are able to be made into ICU rooms. So we've added about 12 to 14 additional ICU rooms if need be. We're all investigating how many events do we have, where are they, what else could be used, how could anesthesia machines be used as ventilators. So we're all looking at what is that potential surge, how could we handle it, how could we manage it. Right now everything is at a place where we're planning and hoping and praying that it doesn't happen. But we're going to try and take care of as many people. We were asked by the state to potentially increase your volume of beds by 50 to 100%. So taking other spaces that would typically today not be used for patient rooms and how to adapt them and accommodate them so that we could take care of far more patients than we would on a regular basis.
Thank you both.
It's my understanding that members of the community are planning a park-in at the hospitals on Good Friday to pray for the healthcare workers and the patients. What's the thinking on whether that's a good idea or not?
I had not heard of that, but I think if that's going to take place, and of course it would be up to the hospitals whether they're going to allow something like that to happen on their property. I think if it does take place, then the same stipulations that I mentioned about drive-in church services should be used. So that is, of course, everyone stays in their vehicles, vehicle windows remain closed, and folks should not count on being able to go into the hospitals to use the restrooms, things of that nature. Not sure if Dr. Bean or Dr. Wicker want to comment about that further.
I've heard that there's a plan for it, but I've not been a part of any of the conversations.
I have not heard of that prior to this, so thank you. We will now do some investigation and try and find out what that would entail and how that would happen. And
Would you like to see that happen or not?
I think it would be okay. I think if there's ways we can do it safely. I know that in some of the hospitals within IU Health system down in Indianapolis, there have been similar displays of support and by the community for the healthcare workers, and that's been quite meaningful. So if we can do it in a safe way, as Dr. Adler has advised, I think that would be welcomed.
And I think we'd say the same thing, that if people would show support, our staff certainly appreciates that. The other day, individuals came and did chalk on the sidewalks saying thank you. Great support. And if people are willing to pray, we'd be all for that.
Dr. Adler, you're talking about additional cases and I guess presumptive cases or some other kind of cases. How many do you think are out there compared to the state numbers? And how would we be able to compare that with the kind of rates that we're seeing at other places? Right now, Tippecanoe County's well behind the state rate, well behind Marion County in a lot of places. Do you guys take that as a positive or something that's kind of a false sense that, of security for the community in a way?
Yeah. So as I mentioned, of course, one of our suspicions for quite some time has been that there are more cases out there than we know about because of the lack of testing, although the testing capabilities are improving greatly. We don't know to what extent, though. Does that mean there are dozens more people out there who have this in our community? Does it mean hundreds? Does it mean thousands? And that's what we're trying to get a better idea of by tracking the numbers of suspected COVID-19 diagnoses being made by healthcare providers. I'm not aware of other communities that are tracking those numbers. And I'm not aware that the State Department of Health tracks those numbers. They track the confirmed cases based on tests. So we wouldn't have a way to necessarily compare the number of suspected cases with suspected cases elsewhere, but we could compare it against the number of confirmed cases in other communities. Your second question was about the lower number of confirmed cases here in our community relative to other communities. I think we're all glad to see any bit of good news, and I consider that to be a bit of good news. Again, as testing capabilities increase, we do expect to see more cases, and particularly over the next week or two, when the projected surge is going to occur, we will very likely see more cases. We don't know, though, to what extent, and that's why staying at home and practicing our social distancing, all of that is really meant to lessen the blow of that surge, to make that surge not as big as it could be. And that's why it's so important that we take these actions now. All of us, everybody needs to do these things so that we can stay ahead of this virus and not have a massive surge in cases.
It seems to me that if you're expecting our surge to be at the 16th or shortly after that, those people would be becoming infected today, sort of, right?
Possibly the incubation period for COVID-19 coronavirus is 2 to 14 days. So yes, so any time between now and then, and even going back several days, would be a potential infection period, yes.
How about, we've had questions about, so how do we know that those cases that we have now are getting better and are falling off of there? And are there any trend lines, any kind of connection points that you're finding right now between the cases, whether in age or in travel or in connection between one another, anything along those lines?
Sure. So to answer your first question, the recovery period for COVID-19, based on what's been seen elsewhere in the U.S. and elsewhere in the world, seems to be around 14 days. And again, that some people can recover faster, some people take longer to recover. To the best of my knowledge, none of our confirmed cases in our county have recovered yet. We're hoping that some of the individuals who were diagnosed early on as some of our first cases should be getting close to that point. But this illness takes a long time to get over, and it's not a fast recovery is what we're discovering. And there was a second part to your question, and I forgot what.
The metrics. What are the connections?
Oh, sure,
right now?
sure.
Is there any trend line that people can look for?
So, you know, when the health department does its investigation of these confirmed cases, they do contact tracing. They try to look for common links between cases, and in some of our cases, there has been a link in terms of a close contact between one confirmed case and another. In terms of age, there tends to be a range of ages, just like in other parts of the country, the people who seem to be affected more seriously, become seriously ill from COVID-19 are individuals who are over the age of 65 and individuals who have other chronic medical conditions that would weaken their immune systems or weaken their overall physical reserve. So conditions like lung diseases, emphysema, asthma, heart disease, diabetes, cancer, any condition that would weaken the immune system.
Are you finding any that are in people who are considered essential, whether they're healthcare workers, police officers, sanitation workers, grocery store clerks? I mean, are you seeing anything along those lines as well?
Well, the one thing about this disease is that it doesn't necessarily spare anyone. So we see cases amongst individuals from different walks of life and different occupations, and we expect to continue seeing people from various occupations and areas to become infected.
Any in those ranges where you would say it's time to shut a certain kind of business down, or it's time to shut a plant down, or it's time to do something greater that you would recommend to the governor or
Nothing like that locally at this point.
Dr. Adler, we have heard that a homeless individual who's COVID positive has been apparently put on a tracking bracelet or a home detention bracelet and lodged in a West Lafayette motel. Can you discuss that and whether that motel was notified of that?
Well, because of patient confidentiality, I'm not able to discuss the details of any particular case, but I will mention that measures like that are not taken very often by the health department. That sort of approach is only used in extraordinary circumstances where there is a true threat to public health, and only when other approaches to solve the problem have not worked. In my time as health officer over the last 7 years, excuse me, we've only had to do that one other time, and that was several years ago, involving, of course, a non-COVID situation. So it's not a decision or action that we as a health department take lightly. It is done, as I said, only in absolutely necessary circumstances and as a last resort. But I'm not able to provide details about the particular case or any particular case.
But is it fair to say?
Well, did something like that happen in this case? I mean, there's no patient confidentiality that you're violating in this particular case, because I don't even know the person's gender, let alone racial, demographics, age, or any of that. Has a homeless person who has tested COVID positive been lodged in a motel?
Again, I don't want to discuss any particular case details because revealing any of that information could compromise the privacy of the individual.
Have any, and this is for the mayors as well, but have any police officers or any other city workers or the county workers who are on the front line tested and are off the job now in any way?
Not in West Lafayette. We actually, Chief Harris and Chief Heath have both been very focused about rules of engagement, contact, distancing, even to the point where they've shut down a lot of the communal spaces within each agency. And the whole purpose behind that is to make sure that if there is an exposure, that there's no secondary exposure because of close contact. The other thing is that the officers, it's sort of a different approach now with officers as they're responding to calls on the street. If there is not a need for close proximity to somebody, then that's not taken. Calls can be handled over the phone through dispatch, and maybe having an officer advising dispatch. That's how it's done. And also, people can just go online, for instance, if it's taking reports for certain things, they'll go ahead and do it that way. You know, and that is one of the biggest challenges that we have right now. Those folks on the front line, whether they be enforcement or public safety officials, healthcare officials, things like that, they've all been instructed. I guess I'm sort of speaking a little about mine here, but they've all been instructed to make sure that they take care of themselves, because an accidental exposure just means that it's going to go further up the food chain.
And I know that in our case, the sheriff's office Sheriff Goldsmith has done an outstanding job of taking extraordinary measures to protect his staff, both in the staff that are responsible for providing law enforcement services to the citizens of Tippecanoe County outside of the jail facility, but then also doing everything possible to keep the virus out of essentially a facility that, if it is full, could hold up to and well over 600 people. And it wouldn't take, if you get one person ill, either in that environment or with your patrol staff, it could impact operations in a big way. So I know that they are doing a lot of work and utilizing a lot of PPE.
We have one city employee that tested positive, to my knowledge, which I think is remarkable when you consider the size of our police department, the size of our fire department, the fact that our sanitation department makes 25,000 stops in 1 week, and what we're doing to keep all those essential services running. I think that's a pretty remarkable number, and as you've heard, There's some extraordinary measures taking place. We've had folks that have had to be isolated till we got some determinations back, but unfortunately all of those came back negative. So at this point, it's my understanding that we have just one, and they are isolating and recovering at home.
What kind of job are you able to say that?
Well, I'm kind of going to follow along Dr. Adler's line there. I would hate to give any additional information to compromise the privacy of that individual. I will say, you know, public deserves to know that it is a city employee, has one.
What is the situation for long-term care facilities, nursing homes, and the rest? I mean, are you seeing any kind of complications there, or are they doing the best they can? What's your assessment of how they're doing right now?
Yeah. That's an excellent question, because long-term care facilities present a particular challenge with an illness like COVID-19. You have a large number of vulnerable, potentially frail individuals living in the same facility. And I would say that our local long-term care facilities have done an outstanding job putting into place protective measures for not only their residents but also their staff. All of the facilities have been essentially on a lockdown for several weeks. They're not allowing any visitors into the facility. They are checking staff temperatures when the staff arrives for their shift. They are keeping sick staff at home and not letting them work. In the instance where, in an instance where a nursing home resident has symptoms consistent with COVID-19, there is a State Department of Health strike team that will travel to that nursing home and do the testing there, so that these individuals are not needing to leave the long-term care facility for the hospital, unless, of course, their illness is severe enough they require hospital-level care. And so that's been a great help also for protecting that particular population.
Has it had to have a strike force come in from the state in these cases?
Yes, yeah, the strike force from the State Department of Health has visited, to my knowledge, at least 2 of our local nursing homes to do testing.
What were the results of those kinds of things? Is that where we're seeing a lot of the results, or the positives, or how are they holding up?
Yeah, they're holding up overall very well, and there have been, I believe, only a small number, very small number of positive test results from the long-term care facility population in our county.
Have any enforcement actions been directed regarding gatherings, businesses? You know, has anything been shut down or stopped as a result of the pandemic?
Sure. So the excuse me, the governor's executive order does lay out a framework for enforcement for the governor's directives, and that enforcement is carried out by various entities, both at the state level and locally. Included in those entities are the Indiana State Department of Health and local boards of health. So there is an enforcement guideline that the state has provided. Here locally, I can say that the enforcement, if you want to use that term, has really been a conversation between the health department and the organization that is planning an event or has been carrying out some sort of operation that could be unsafe, and that those conversations have resulted either in modification of those activities or in cancellation of a large gathering and whatnot. So, so thus far we have not had to take that enforcement to the next level of, say, a health officer's order or involvement of the courts or things like that.
Can you characterize what those gatherings would have been?
Sure. For example, a topic that we had addressed a little earlier was church Easter egg hunt, Easter egg gathering that would involve what we would determine to be non-essential travel or non-essential activity. And again, a conversation was all that was needed to remedy the situation.
We've had a little bit more of that. In West Lafayette, that's why I ordered all the basketball rims to be taken down. We have a lot of parks, we have a lot of outdoor recreation opportunities, and we've got a very strong population base between the ages of 18 and 26. A lot of folks, a lot of our students have gone home, obviously, but there's still some that are still staying in their rental properties throughout the neighborhoods. And obviously, because their academic stress has been relieved, there's still the opportunity to gather in large groups, in other words, over 5, and to conduct themselves in a way that would be more common for times prior to the COVID virus. And what we've done is have empowered the police department to go ahead and make strong recommendations to break the crowds up, and up to this point, they've been fairly compliant. Even in our playgrounds, our trails, the outdoor recreational opportunities that we provide as local government, it just requires usually person in authority to go ahead and make a recommendation of keep their distancing correct, or to go ahead and stop the behavior in the first place. And each time we've had compliance. And I don't think that it's a lack of willingness to do the right thing. I think that it's just sometimes a display of youth. But as soon as they're made aware of the circumstances and the potential of the circumstances, they comply.
Mayor, have you had to issue tickets at all?
No, once we put the tape up, the actual tape up around the playgrounds, and we did it around all of our picnic shelters and all those types of places, like I said, the signs didn't work too good, but once we put the tape up, the compliance has been remarkable of people not using the playgrounds, not using the picnic shelters, and some of those things. I mean, I can't tell you it's been perfect maybe, but I check a lot. Our park security is checking a lot. We're keeping a close eye. All of our restrooms are locked in the parks too, even the satellite parks. So as nice as the weather's been, it's been people have been doing a pretty decent job on everything we've put the yellow tape up on.
And if all else fails, make a video.
What we have noticed at the health department is that many times it's simply just a misunderstanding of the executive order or a confusion about it. It's a strange topic. It's different from the way we've had to live our lives, and so a lot of times if we just explain the purpose and the details of what we're trying to accomplish, that most people are very understanding and very willing to comply with the restrictions.
Dr. Adler, can you walk us through what the investigation looks like when you're notified somebody's been diagnosed, and then when these numbers continue to build? Are you able to keep track of all of them, and how far back do you go, say, where they've been, other counties they've visited, who they've been in contact with, and you notify those people? How far back is that?
Mm-hmm. So the contact tracing process or protocol is very similar to what our public health nurses at the health department have been doing for many years for other communicable diseases, and they work in conjunction with epidemiologists from the State Department of Health in assisting and determining how far out from a confirmed case you go. It differs from case to case depending on where an individual lives, the size of their family, where they work, where they've traveled to, so on and so forth. But they have ways of determining who the relevant close contacts are, and then those individuals are contacted and placed into quarantine, advised about symptoms, what to do if they do develop symptoms, things of that nature. As the case numbers get larger, of course, it becomes harder to do these things, and we're actually working on expanding our contact investigation team with possibly volunteers from the medical community and even the local school of medicine. That's still a work in progress, though.
For the hospitals, do you feel you're well-staffed at this point, or will you also be calling people out of retirement or looking for help elsewhere?
We have sent out those surveys to our medical staff, our entire medical staff, including retirees, including our nurse practitioners and physicians associates, assistants, our PAs, and asking if they'd be willing to participate. So we're accumulating those lists and deciding who would be the most, who we should use first and who we should use second, and how we would prioritize those individuals. And then whatever training they might need to, if they've been out of the hospital for quite a while. We have challenges with our new electronic medical record systems, and individuals that have not been part of that would have to be retrained in use of the electronic medical record system. So we're in process of accumulating that information, assessing that, and then deciding who and how we prioritize and how we educate those individuals to participate if need be.
Yes, very similar with IU Health Arnett. We have a phased approach of identifying and then orienting and training our clinic-based physicians, advanced practice clinicians, nursing staff, medical assistant staff for various roles within the hospital. So that's actually happening as we speak. There's a cohort of clinic-based nurses today who are participating in an orientation experience at the hospital should we need to call on them. As I referenced earlier, many of our outpatient clinic visits have gone virtual, and many non-essential visits have been delayed for a number of weeks. And so there's capacity of people here within our organization to be redeployed around. But we also have a statewide system that has a resource pool of individuals that have been identified from around the state that can be shifted to areas of demand. So for example, we have had some of our intensive care nurses go down and help in the hospitals in Indianapolis that are currently experiencing a surge. A small number, but a meaningful contribution to their needs.